Do you have foot and knee pain and not really sure what shoe to choose? I'm Dr. Jody Freedman, a chiropractor at Willowbrook, Chiropractic in Langley, and today I'm here at Kintec with Kelsey, the store manager and a podorthist, and we're going to talk about choosing a shoe when we have some pain inside of our body. Thanks for having me.
Thanks for coming.
So, obviously a lot of my patients have foot and knee pain. I know this is like a very general start, but if we get into the specifics about someone, let's say that comes in with an arthritic knee, where are you getting started with that person in terms of deciding what shoe would work well for them?
For sure. At Kintec, we have a bit of a fitting process. So the biomechanics of the lower limb are really important. So we take a look at their gait and how they walk, and then we help look at the right kind of shoe for that foot in order to support it correctly. So osteoarthritis is one of those conditions where we want to be careful about the stack height of the shoe. So when we look at a lot of running shoes, they've really changed over the years, but the stack height is kind of the thickness of the midsole of the shoe. The higher we go, that can definitely create a little bit more lack of, I guess, proprioception with the ground. And they can also create a little bit more strain on the knee, just depending on the patient. So we definitely want to take the biomechanics into account, but certainly look at some of the features of the shoes that might suit them better.
Okay, so with a high stack height, that's going to give kind of that floaty feeling that some people like.
Yeah.
But if you've got an arthritic knee, then that may not be the right thing for you. Then.
Right.
So okay.
Yeah. Mm-hmm.
So where would you kind of point people in terms of choosing a shoe that has an arthritic knee, for instance?
Sure. So when we want to look at just generally what the patient has been wearing to know obviously if it's been working or not working for them. But let's say that person wears orthotics already. So we probably would want to be looking at a shoe that has a relatively medium to lower stack height of the shoe, and also the drop of the shoe is really important too. So depending on if the foot is higher in the back versus lower in the back, that will also change how the knee is positioned. So with osteoarthritis, again, we just want to be careful of where that person's body is in space and kind of generally what they have been wearing to compare. So this one here, for instance, has a 10 millimeter difference between the heel and the ball of the foot. Where these guys will have something like 4 to 6 millimeters. Okay. So quite a bit different, and again, different strain on the knee.
Okay. So again, stack height and then the drop are the two things that we're considering here, along with the overall fit of the shoe, obviously.
That's correct.
So great. Okay. And then again, we look at another common condition like plantar fasciitis. So what shoes would you consider, and maybe what shoes would you kind of push to the side for someone that's coming in with plantar fasciitis? Then?
So very painful condition for sure. So when we look at that, we want to just see obviously the biomechanics of the foot, but generally when it comes to the shoe, something that can actually help that condition is looking at a shoe with a bit of a rocker. A rocker is when the very front of the shoe it has a natural toe spring, but it's very stiff. And so in terms of how the gait cycle is, when we try to push off our toes, we need to flex the front of our foot typically. The more we do that, the more it stretches the plantar fascia out. So having the rocker reduces the actual stretching of that tissue and relieves some pulling on the heel, where typically a lot of the pain is.
Yeah, so. That's great. So the Hokas would be a good option often, obviously a lot of other considerations, but it would be a good option for a lot of people with plantar fasciitis.
For sure. Hokas are one of the brands. Many brands are doing the same thing with a 4-foot rocker. So not just Hokas, but many other brands also we carry would have that, depending on what the foot needs in terms of its fit.
Okay, so got it. And then again, another common condition that I'll see is like a metatarsalgia, where or a lot of people just recognizes that the outside toes are sore, or they're getting pinching in between their individual toes. What considerations are you looking at for a shoe for them?
Definitely. So number one would be looking at kind of the toe box shape for that person. Some people, some shoes are a lot more tapered and pointed. So if we just kind of compare shapes here, we want to try to match the foot shape as best as possible so we don't get squeezing across the metatarsal heads. But the other feature would be something like a rocker again. So the more that foot can flex into the front, the more that those metatarsals can sink into the ground and nerves can get pinched. So having that rocker certainly may be a helpful piece to offloading the forefoot.
Great. And again, the last one would be like an Achilles tendinosis that I often see as well.
Yeah.
Is there some consideration in shoes for that as well?
Absolutely. So when the Achilles is injured, the more the heel drops to the floor, the more stretch the Achilles needs. So definitely the actual pitch of the shoe, so the difference between the heel and toe is a big one. So something that's much flatter heel to toe may not be very helpful or comfortable compared to something that's a little higher in the back, lower in the front. So that will kind of reduce the strain and stretch on the Achilles tendon.
Excellent. And I've seen a huge difference from one patient to the next in terms of the recovery, in terms of what shoes they're wearing, and again, it can make an enormous difference. I've seen that firsthand before. So
Sure.
thank you so much for answering our shoe questions today, and thank you for having me at the store.
You're welcome. Thank you.
Again, if you have any more shoe questions, feel free to ask myself, Dr. Jody Freedman, or Dr. Robin Armstrong. We're always happy to help.